guys, today we are going to be talking about the different arm of care in the healthcare sector in the United Kingdom. Hello guys, welcome back to my channel, and I hope you're doing great wherever you're watching from. So I'm going to be listing the different arm of care that we have in the United Kingdom and their job description or job specification. So I'm going to start from residential home. We have nursing home. We have support workers. We have domiciliary care. We have live-in care. Then we have the healthcare assistant that works in the hospital, and we have the nurses itself. So we are going to start. I'm just going to talk about the different kind of care as I've listed them, the different kind of care and what their job description is, because I've gotten a couple of questions asking me, oh, I heard you talk about home care, or I heard you in your previous video talk about nursing home. What are the differences? So I said, you know what, let me just make a video and explain the different kind of care that we have here in the United Kingdom and their job specification. So I'm going to start with the residential care. So residential care is like a home where the elderly they are looked after. So residential care is a kind of care whereby an elderly person that is vulnerable to live by themselves in their own home, they come to a residential home. In that residential home, they have their own rooms, their toilet and their bathroom, but the kitchen and the laundry aspect is managed by the home, and they literally live there. Like that becomes their home now, because they are no longer living in their home. Maybe either their children are all no longer lives with them. Children are married, doing their own thing, working, and these old people, they will not be able to be on their own in their own house. So some of them, their children make the decision for them to bring them into residential home, where they know that yes, they will be well looked after and they will be safe, instead of them living in their own home. So in residential care or residential home, you will see a lot of old people, not basically that they are sick or anything. These are people that are healthy, they can do things themselves, they can bathe, they can do literally everything. All they just want is that companionship, whereby somebody is always present there. So there are carers in those kind of places 24/7. They do different kind of shift pattern, long day, short day, nights, and whatever, but there is always carers in residential homes, just to make sure that the elderly people there, they are well looked after and they are safe from harm or abuse. So those are residential homes. So some residential home might have like 20 rooms, 15 rooms, 30 rooms. It depends on the capacity of the home. And each of these rooms, they have their own toilet and bathroom. So the resident, they are basically living as if they are in their own home. Everything is well organized. They eat their prepared meals. They have chefs that comes there that work in those homes. They prepare their food. They are well looked after. They do their laundries. They have like a lounge where all the residents will come out and sit and watch television. They will have like activity of the day. I mean, it's beautiful when you work in that kind of setting. I tell you, it's really, really beautiful. I've worked in residential home. I worked in residential home for a while, and I absolutely loved it. Like, it's so beautiful to see all these different characters coming together, like being as one big family. Is beautiful. So that is residential home, where old people of different ages come together to live as if they are one big family. Looking after them are the carers and all that staffs that are making sure that their day-to-day lives are run as normal. So that is residential home. And yeah, we have a lot of residential homes in this United Kingdom. So that is residential home. So the next one I'm going to be talking about is nursing home. So we have nursing home. Nursing home, again, we still have elderly people, but most of the people that goes into nursing home is like people that needs the care of not only healthcare assistant or senior healthcare assistant, but the care of nurses. Most of them, they are patients that are discharged from hospital. They are clinically discharged from hospital, but they still require the input of nurses. For example, these are patients that goes home with like peg feed, rig feed, NG tubes, catheter care, insulin, and many of other, clinical care. So this group of patients are discharged into the nursing home, where you have nurses on the daily basis, whether it's night or day. They are always nurses. They have like they have like complex medication that they need nurse itself to dispense, to monitor some other clinical observations. So this kind of patient, they discharge them into nursing home. So nursing home is a little bit heavier than residential home. Residential home is mainly elderly people. Most of them can do things on themselves. But nursing home, on the other hand, are those patients that are discharged from a hospital, like I earlier stated, that require the input of nurses. So they are discharged into nursing home. Most of them, they use oils transfer. They have catheter that they need nurse from time to time to flush. They have insulin. They have like some blood pressure medication that need the monitoring of a nurse. And yeah, those are the kind of patients you will have in nursing home. And the next one I'm going to be talking again is domiciliary care. So domiciliary care is another arm of care in this country, whereby the service users, they live in their own home, and the carers, they go from home to home. They offer them the care. Some of them, they have like 15-minute call, 30 minutes call. The call might be like just to go in there and give them personal care, transfer them maybe from bed to chair, prepare them for their breakfast. Lunchtime, again, you go, you do the same. And dinner time, you go again. After them having their dinner, you transfer them back to their bed. And yeah, that is the call for the day. Some of them have like a QDS, which is 4 times a day. Some of them 3 times a day. Some of them once a day. But this kind of service are rendered to the service users in their own home. They live in their home. For instance, a service user might have, he can afford to pay for his care, and he doesn't want to move into either nursing home or residential home. The service user prefer to live in their own home, and they will, have this care delivered to them in their own home. They live, maybe their family member or they themselves, is individual choices or family collection of both. They make the decision that, we want our mother or our father or our sister or our brother to live in the house. We'll have the service, we have the carers come to the house to give them the care that they want. And yeah, that is it. That is basically domiciliary care. So they go from home to home to look after the patient, to offer to render the care and support that this patient need in their own home, and they go back. Some of them have those kind of care 3 times a day, depending on the need of the service users. I've equally done domiciliary care, but I didn't do it for long. I did it for a while because I wasn't driving at the time. One of the important things about domiciliary care, if you want to go into domiciliary care, you need to know how to drive, because most of the care that you're going to be giving is like in a different location. You might have one care here and the other care will be like 10 or 15 minutes away, and the time for you to travel from this point A to point D will be like 5 minutes. So if you're not driving, you're going to find it difficult, and most of these places are rural area where you cannot easily get transport link to take you from point A to point B. So majority of the people that goes into domiciliary care, they drive, they have their own vehicle, which will make the movement much easy, and you'll be able to cover all your call for the day very quickly. But if you're not driving, it's really difficult. At the time I wasn't driving, it got to a point I could not cope again because I wasn't driving, and yeah, I have to look to somewhere else. Otherwise, it's one of the cars as well. It's so beautiful, because what more satisfy you than going to somebody's home to give them care, to make them comfortable in their own home? I mean, it's beautiful. I loved it when I was doing it. But if you're considering going into domiciliary care, you must learn how to drive and have a car to make your life easy for you. So that is all about domiciliary care. Now, the next one I'm going to be talking about is actually live-in care. So there is another arm of live-in care. This kind of care is whereby the carer will live with the patients in their own home as well. You remember I talked about this. The third one was domiciliary care, where we go, where the carers goes to the patient house like 3 or 4 times a day, depending on the need of the patient. But live-in care itself is whereby the carer itself live with the patient in their own home. So this group of patients, this kind of care, they need a carer to be in the house 24/7. Maybe the service user children are no longer living in the property, maybe they are no longer in the country, or even if they're in the country, they are far away, and the service users wants to live in their house. This kind of care, the carer has to be living in the house with the service users. They actually create a room. I've done this one again. I've been them all, guys. So yeah, this one, you live with the residents in their own home. They allocate room for you, and you just basically make sure that they are safe, they are well looked after. Some of them, like when I was doing live-in care, my client then has a cook, has a cleaner, has a driver, then I am the carer. So that is how it works. Why some of them, they don't have, you are just there to do almost everything, and it's not like really a healthy, it's not like a difficult job that you cannot do if they don't have this kind of, it depends on, like I said, the financial situation of each of people are different. So it depends on whoever that you're looking after. The person that was my client then had all these different services that I've mentioned, but some they don't have. So it's just going to be you and the service user. You want to make sure that if the service user have maybe appointments in the GP, in the hospital, you'll be the one to escort them there. If they are going for shopping, you'll be the one to take them there. To make their hair or to cut their hair, you will be the one to organize. Basically, you are just running their day-to-day activity for them. Make sure that everything works smoothly. And this kind of care, some of the time when I was doing it, at times you say 1 week in, 1 week out, or 2 weeks in, 1 week out. That is how it runs. So you just be there, and after 1 or 2 weeks, somebody else will come and take over from you. You now go off and have your time. After 1 or 2 weeks, you come back. That is how it's rotated. So this kind of care is whereby the carers itself lives with the service users in their own house. Is called live-in care. Then the next one I'm going to be talking about is support worker. So support worker, I have also done support worker. Guys, I have moved from from one arm of care to another arm of care in this country. Yeah, so support worker is basically run in the community. So this kind of care is whereby these service users, they have their own home, like it's run by a company or an agent or whatever. They rent at times it's local government or the council itself. So it depends, but it's mainly at the community setting, where they will rent like a big house, a house that has like 5, 6 bedroom, 10 bedroom. It depends on the service user that they have. So all these service users, they have their own room, toilet and bathroom in their own house, in the house itself, and the carers comes there to do like a rotation shift. So you have like early runners, late runners, and the sleepover. They call them sleepover. So this kind of care, some of these kind of service users are people that have some health challenges, like learning difficulties, like disabilities. These kind of people are people that lives in the community, and they need support worker, people that support them. It's not like they cannot do things on their own. Some of them are young kids, average age, of any kind. We have disability of any kind, like ranging from teenage to adulthood. So this kind of service users, they need 247 support workers by them, whether they are going, some of them, if they are going to college, support worker will go to them. If they're going to hospital, support worker will go with them. Anywhere at all they are going, support worker will always go with them. So they need the care of, they need somebody by them, by their side at all time. So this arm of care is called support worker, and is mainly run in the community. So the next one I'm going to be talking about is healthcare assistants actually working in the hospital. So healthcare assistant in the hospital is where now we call them like NAs, like nursing assistant. NAs are healthcare assistant that works in the hospital. At the run of the shifts, you and your nurse, you liaise what you want to do this, want to do that, mainly because at times the nurse is focused mainly on medication. Then when it comes to personal care, the nurse and the healthcare assistant will team up to give the patient personal care, or healthcare assistant can help in checking ups or BM and other things, just to make sure that the shift runs smoothly. So NAs are basically healthcare assistant working in the hospital setting. And we have the district nurse. This is the last one I'm going to be talking about. The district nurse is nurses that works in the community as well. So district nurse are nurses that works in the community to deliver care to patients in their own home, like dressing the patient wounds, giving them insulin, giving them community palliative care. So these are the roles of the district nurse. So district nurse as well, they go from home to home to give care to the service users in their own home. So all these are the different arm of care that we have in the United Kingdom. I hope you enjoy watching this video. If you have any questions, still please do well to drop your question in the comment section, and I will do well to get back to you. If you haven't subscribed to this channel, please kindly subscribe and become part of this channel. So whenever I upload a new video, you will be the first to get the notification. Until I come your way next time, remain blessed. I love you. Bye.